Hi, my name is Amber. Imagine right now that you are having some discomfort or pain in your jaw or your arm, or maybe even your neck or back, or maybe you're feeling nauseous. About every 34 seconds, someone has a heart attack, according to the American Heart Association in 2013. The American Heart Association also states that most women chalk up their symptoms to the flu, normal signs of aging, or even acid reflux. Many of my audience members are women, but even if you're not, odds are you have someone that you care about who is. As a nurse, I have had female patients that have had heart attacks. Heart disease is the #1 killer in women, but it doesn't have to be. In this speech, I will go over some signs that you could be having a heart attack, some actions you can take if you think you are having a heart attack, and ways to prevent having a heart attack in the first place. First, I will discuss the potential signs of a heart attack. The American Heart Association in 2013 states, "Many women think the signs of a heart attack are unmistakable. The image of the elephant comes to mind. But in fact, they can be subtler and sometimes confusing." The American Heart Association in 2013 gives some signs of a heart attack. A heart attack in women can present as chest pressure or discomfort that lasts greater than 3 minutes or that stops and comes back again. A second sign you could be having a heart attack is pain in one or both arms, jaw pain, pain in your neck or your back, stomach. The third sign could be shortness of breath. This does not have to accompany exertion, like if you're exercising, it could just come on suddenly, and it does not have to include any chest discomfort either. The fourth sign that you could be having a heart attack is if you're nauseous or vomiting or lightheaded, or you break out in a cold sweat. These subtle signs show that the elephant is not necessarily the symptom that you will have when you have a heart attack. Since I've given you these symptoms, I'm now going to give you some actions you can take if you think you are having a heart attack. According to a 2008 article from the Harvard Heart Letter entitled "Dial 911 When a Heart Attack Has Your Number," when a heart attack strikes, 2 steps can help protect your heart and your life. First, recognize you're having a heart attack. Second, call 911 or your local emergency number. Calling 911 is the fastest way to get treatment for a heart attack. The American Heart Association in 2013 gives these statistics. Paramedics are able to begin treatment when they arrive, which can be up to 1 hour sooner than if you arrived by car. Also, patients who arrive in the emergency department typically receive faster treatment than if they arrive by car. The 911 operator that you call may advise you to take a 325 milligram dose of aspirin. If you do not have one pill, you can take 4 81 milligram baby aspirin if you have those around. Now that I've given you some signs if you're having a heart attack or actions to take if you think you're having a heart attack, I'll give you some ways to help prevent from having a heart attack in the first place. According to a September 3rd, 2013 article in USA Today by Nancy Helmick, about 800,000 people die each year from cardiovascular disease, but as many as 200,000 of the deaths from heart disease could be prevented if people made healthy changes. The first change you can do is to have a heart-healthy diet. This includes lots of fresh fruits and vegetables, a diet low in sodium, and a diet full of lean cuts of meat such as chicken and lean cuts of steak. Second thing you can include to help prevent heart disease is regular exercise. According to the CDC in 2011, most adults need 150 minutes of moderate intensity activity weekly. So you could take brisk 10-minute walks 3 times a day, 5 days a week to reach that recommended amount. Third thing you can do is quit smoking if you do so. According to authors Ignatavicius and Workman in 2010, page 710, 3 to 4 years after a patient has stopped smoking, his or her cardiovascular risk appears to be similar to that of a person who has never smoked. As Benjamin Franklin once said, an ounce of prevention is worth a pound of cure. Now that you've heard my speech and heard signs if you're having a heart attack, actions to take if you think you're having a heart attack, and ways to help prevent a heart attack, I hope you'll be able to better take care of yourselves. Heart disease is the #1 killer of women, but it doesn't have to be. Now imagine that you're sitting there and all of a sudden you're getting jaw pain, or your one or both of your arms are hurting. Maybe your neck starts hurting, maybe even your back or even your stomach. Maybe all of a sudden you feel nauseous and lightheaded and you break out in a cold sweat. I hope that by hearing my speech, you will now learn to not ignore your body signs. Being educated about heart disease could save your life or the life of a loved one.